And we are back, and our guest for the second part of this episode is State Senator John Gordner. John, how are you doing today?
All things considered, Chris, I'm well. I can see you're outside at your house, so you look comfortable. Hope you're doing okay.
That is one of the nice things about working from home. If you have a strong Wi-Fi, you can be outside to do work, and it has been a pleasure and a little bit of a pain when the young ones are around. All right, so first off, I can't remember a situation or a time when states have figured so prominently in a national discourse like they are today. Do you agree?
Yeah, you're certainly correct, Chris. I've been in the state legislature for 28 years now, since 1993. We've gone through snowstorms. We've gone through obviously huge flooding incidents. We've gone through Ebola and SARS and swine flu. But there has been nothing even remotely close to this. And its impact nationally, worldwide, statewide, community-wide is just unbelievable. It's literally a 102-year event. I think the last pandemic like this was the one in 1918. So those in our lifetime have never seen anything like it.
So what's the current status for Pennsylvania is that we're all under a stay-at-home. So what does that mean?
The stay-at-home, which the governor issued for the entire state about a week ago, there had been a number of counties, and they had increased to about half the state, and then just last week he just made it effective for the whole state. Basically means that you need to be at home. You can go out if you need to get groceries. You can go out if you need to get food, if you need to go to the pharmacy, if you have a essential life-sustaining job that you need to get to. But other than that, you shouldn't be going to a neighbor's house or a friend's house to visit. You should certainly check on elderly relatives to make sure they're okay, but not necessarily go inside their home and visit with them. So unless you need to be out on the road to travel to one of those type of places, you should be at home.
And we're wearing masks now too, or at least encouraged to.
The governor, yes, late last week is encouraging folks basically to protect others. There's a whole discussion at the national level whether masks were beneficial or not beneficial, but I think the logic is that a lot of folks may have the coronavirus but not have the symptoms, not have the high fever and the coughs and the respiratory problems, and so they may not show it, but may have it. So in order to protect others, if you wear a mask, you are helping to protect not spreading it to someone else when you may have it and not know you have it.
And I think, was it a week or two ago, the disaster declaration came down from the federal government for Pennsylvania? What exactly does that mean?
That just makes sure that any and all federal dollars, any and all federal programs that may be available to states that we can take advantage of. I'm sure you saw weeks ago that most, if not all, the counties and municipalities, even townships, got together and did the same thing. But it just makes sure that you are eligible, whether it's the residents within it, whether it's businesses, or whether it's the municipality itself, if they have costs or expenses, that they are eligible for federal monies and federal programs.
So what's the situation like in Harrisburg with the legislature? What's the status down there?
So 3 weeks ago, I think it was, we met and we adopted remote rules, which would allow the legislature to meet remotely so that we wouldn't have to gather 50 senators in the Senate and 203 members in the House. And so we've now had 2 weeks of session. This week we met both Monday and Tuesday remotely. There were, I think, 7 of us on the Senate floor. I'm, as you may know, the majority whip, so I was there along with the majority leader, the Democratic leader, and the president pro tem. We had 2 or 3 local senators, but everyone else participated remotely. They were in their districts or they were at their homes through a Zoom conference. We took roll calls. We considered legislation. We had committee meetings. And you know what? It all worked out pretty well. So we're doing that. Last week when we met, the Senate and the House both passed, I think, 4 bills two from the House, two from the Senate, unanimously. They went to the governor and were signed into law. This week, the Monday and Tuesday that we were in, we put all a bunch of different issues into one bill. And again, at least in the Senate, we adopted it unanimously and sent it over to the House. So we're working pretty well together, which is good.
So, and all of your staff members, all of their staff members, legislators, they're all working from home or satellite offices, or just working from home?
So up until Harrisburg's been closed down for 3 weeks. The governor did that in regard to the Capitol building, and both the House and Senate, the Democrat and Republican leadership told all our Harrisburg staffers to work remotely. So the good news is that all of our offices in Harrisburg were set up that way. They all have laptops. They all have state-issued cell phones that we could access our voicemails and all of the emails. I think on Friday between Harrisburg and the district offices, we had over 100 constituent contacts. So that's a lot of contacts. What I was doing with my district offices, we closed them to visitors probably 2.5 weeks ago, but I was having them in the district office just so they could answer a phone initially when someone called, or be available by email, which was beneficial. But when the governor did his statewide stay at home last week, I told my district offices, we need to be back in your houses as well. So again, in the last couple of weeks, we equipped them with laptops and the ability to access voicemails. So we are doing that as well. But again, just last Friday, we had over 100 constituent contacts between phone, voicemail, email. And so it's very beneficial for them when they're calling other numbers and not being able to get through, that they can contact their local state house member, state senator, and get an answer.
Now, those reach outs by constituents, are they dealing with just problems of the day, or do they have to deal with COVID-19?
No, most of them are COVID-19 related. We've certainly had a lot of phone calls in regard to unemployment compensation. You and I were talking before the taping started here that the numbers for Pennsylvania are over 1 million. So over 1 million workers have filed for unemployment comp assistance. And it's something that has never, ever been seen. I was around in 2008, 2009, 2010 when the stock market crashed and the banks collapsed. And we, I think, had 1/4 of that. So those numbers are huge, and people were trying to call in and not being able to get anyone. So we've assisted people, especially with doing it online. And you can also do a online chat if you go to the LNI website. But the federal government has made some additional folks eligible for unemployment comp who've never been eligible. For instance, self-employed individuals have never, ever been eligible for UC benefits. They are under the Federal CARES Act, as well as independent contractors. So the challenge is states have never been prepared for that because they've never been eligible. So at the moment, they're still not able to apply, but we're telling them what they need to look for and wait for. We've been hearing from a lot of businesses wondering when they might be able to reopen, asking why you can go to Lowe's and buy lawn furniture, but why the local downtown business that may only have 2 or 3 people in the store can't open. Car dealerships, you can't buy a car right now if you have a lease and your lease payment has ended. There's issues, so we've been getting those calls. But then when the governor did what he did with face masks, with people that are having driver's licenses or car registrations expiring, wanting to see if there's extensions on that, real ID, all sorts of different things. So it's been an interesting time.
So if someone has unemployment or needs unemployment, they can't do it just yet?
Any normal worker who has been laid off as a result of COVID-19 can certainly apply, which is 90% of the folks out there. Folks were trying to call, which, as you can imagine, if you were going from around 10,000 claims a week to 200,000 claims, the system just can't handle it. And so most people have access to a computer. You can file it online. There again is e-chat, where if you're patient, you can chat with someone online. But again, unfortunately, there are folks that, in the past, their access to a computer was the library. Well, libraries are closed. We still have career links in the area. Career links are closed. So we've been trying to assist people the best we can, and working them through it and making sure that their claims are filed and they get the PIN numbers, those sorts of things. Actually, folks, we just heard this week that folks that did apply a couple of weeks ago, the checks are out, and they're starting to get their first UC checks, which is certainly important.
We aren't seeing any problems like they are seeing in New York, though, from what you've heard so far. Are we?
In regard to the hospitals and the number of...
in regards to unemployment filings in New York, people, for some reason, New York, as a last contingency for filing for unemployment, they have to call. They have to call into the office. We don't have to do that in Pennsylvania, do we? Because all they're getting is a busy signal or a message that says they're just swamped.
Yeah, and again, the Department of Labor and Industry, actually it was not interesting, but the governor just last week, if you saw, laid off a lot of state workers, about 9,000 state workers. A lot of them are PennDOT related, that a lot of PennDOT workers can't do things remotely. The governor has closed down most construction projects and maintenance type of things. And there was also a lot of L&I folks that could not do things remotely. So they've been offering those folks the ability to move over to the call centers to, I think, double the number of folks that are available. And again, you file a claim and then you need a PIN, and people were not getting the PIN and then getting very anxious that their claim was not good and they'd have to start over again. And we were making sure that, no, if you filed the claim and it's in the system and we can double check on it, you just may need to wait a little bit for PINs. But again, from what I understand, just in the last day or two, 70 or 80% of those folks who were waiting for PINs now have them. So hopefully that will give a lot of folks ease and comfort that their claim is being processed.
Are you hearing anything about the hospital situations in our area on your end, what they're dealing with yet? Because our numbers, with the exception of to your east in, say, Hazleton and Wilkes-Barre, our numbers aren't that high yet, relatively speaking, to what the rest of the state is seeing.
Yeah, we've done some check-ins, and the hospitals in our area, I think of Berwick Hospital, Bloomsburg Hospital, obviously Geisinger, Shamokin Hospital, and Evangelical, have all been fine. They have the PPEs. I know that the PEMA has actually provided those type of masks and other provisions to each of those hospitals. They've also made shipments out to nursing homes in our area as well. Hospitals were the first priority, nursing homes were the second, and they've all had their deliveries. So I'm not aware, and matter of fact, I'm actually confident that all of our local hospitals have the supplies they need at the moment.
Okay, so we have been ending these segments on a personal note, by asking the people we're talking to how they're dealing with the situation personally, and how have you been handling it, and how have you been coping with, say, being at home as much as you are now?
Yeah, I certainly have spent a lot of time either here in my home office or at the kitchen table, which I commandeer most days. I've had more Zoom conferences, Zoom meetings, telephone conferences, those sorts of things, emails, phone calls, spoken with all of our local state reps and Congressman User probably every 2 days. But as you may or may not know, I'm a runner. I've been a lifelong runner. I'm actually still an assistant cross-country coach. So just shortly before I got online with you here, I ran out and ran 4 miles. The one very cooperative the last couple of weeks. I'm not a cold weather runner. There's actually some races I was going to be doing. There's one in Snyder County that I was going to be doing, I think, a week or 2 from now. So I'm missing out on the 5Ks, but still enjoy either running by myself or on the weekend. There's 2 other guys. We practice our social distancing, but we go out for about 5-mile runs on Saturdays, Sundays, and it's good just to clear the mind and to get outside. And I certainly would encourage folks to get out, to get to the parks and the different places. Just make sure that you're practicing the social distancing that you've been advised to do.
State Senator John Gordner, thank you for your time today. We really appreciate it.
Thanks, Chris. Thanks for having me on. Stay safe.
You as well. And that's going to do it for this program. Stay tuned for more episodes of conversations on COVID-19 right here on SECV8, the continuing series of In Your Neighborhood. I'm your host, Chris O'Rourke. We'll see you soon, and stay safe.